When I was really sick, I got down to under 100 pounds. I wasn't really eating. I was just kind of laying in a bed, not really doing anything that I thought Sydney Beason was.
When she was 17 years old, she was diagnosed with thyroid cancer and spent her junior year of high school battling this disease, only 2 years after her mom's own diagnosis with cancer.
This summer, after graduation, I will be running from Baltimore, Maryland to San Francisco, California.
Sydney Beason is a senior public health major at Furman University.
When I came to Furman, I heard about this race called the Ulman 4K for Cancer that ran from Baltimore, Maryland to San Francisco, California, 8-week long, and it just captivated my attention and knew it was something I wanted to be a part of.
The Ulman Foundation is an organization that supports young adults and their loved ones impacted by cancer. Sydney is making her own impact as she gears up to run 4,000 miles across the country this summer.
So one of my personal goals is to finish it. Obviously, something like that requires a lot of hard work and just muscle endurance. But emotionally, I want to just connect as many people as I possibly can from coast to coast that have gone through this or are going through cancer treatment, and to help them and to build community that heals within. I was blessed to have family and friends that were with me every step of the way. I had an incredible high school friend group, and they were with me in the hospital when they could be. There were weeks where, you're in ICU and you can't have visitors. But as soon as that got lifted, they were there wheeling my IV cart down the road. And I can know that that was what got me through the days that, people questioned how it was going to end. And I never questioned the support and love that I had for them. My mom left the hospital probably twice the entire time that I was there to shower. She used my shower and would eat my food. And that she was just always there. And I think that helped me know that there was always going to be a light at the end of the tunnel. But I know I'm very lucky to have that, and a lot of people don't have that. And so how can we build that into people that aren't born into that? I think there's a part of treatment that kind of makes you feel separated from your body. In this situation, your body has failed you in a sense. You feel like you're sick, and it's not the body you used to be. And so slowly, as I got more white blood cells back and things like that, I was able to feel like I was in my own skin. And so I started moving and walking around the hospital. My dad and I would go to the playground on the 13th floor. And then once I got out, one of my doctors actually looked at me at one point that I was laying in the bed and said, why are you still laying there? You're not sick anymore. And those kind of words stuck with me for a really long time, in the sense that you're not sick anymore. Let's start moving again. And so since that, I haven't really stopped moving. My mom and I run a lot together. It was a way that we were able to, just be alone, the two of us. So we would run all across town. And it was a way I felt like I was back in my own skin. She was back in her own skin, and we could talk and be away from the world for just a little bit. I think we all have a lot of choices in our life, and it's a matter of choosing which one's going to be the most important in that point. Getting up at 5 a.m., it's, a difference between an hour of some other people that get up, but I can get a little more done if I get my run done before my day starts. And so I've just kind of tried to continue to prioritize that and get up early, get that done, and then the rest of the day gets to be enjoyed doing all the other things as well. I love the hospital, and that sounds so funny for someone who spent a good part of their junior year there. But I think there's something about that I wanted to get back to. And so I knew it was something in that career. But I actually started working for a clinical research company that helped me feel like I was contributing to research, but also seeing patients on an individual basis. And so I could not only advance research, but also be connecting with patients along the way. So I got involved in clinical research, and through that found public health to be the best stepping stone to continuing my career there. My tagline is always, cancer saves lives, but so can we. And I think that kind of motto is something that everyone can apply to their lives, is that we have a choice to let something define us or describe us. And so we can take something, a situation, and make the very most of it.
As Sydney's journey begins in June, she needs all the support possible. Follow along on her Instagram, Sydney Strides, or read her blog posts and consider donating to the Ulman Foundation at sydneybeason.com.